before we were with the United Healthcare exclusively, and we were the largest OEP or IMO with United Healthcare from Texas all the way up to Chicago. So we had a very robust team, and we did really well with one carrier. However, we did not have the ability for our agents to be able to grow and develop their own agencies. It was kind of by invitation only. If they liked you, if they felt like you had the ability, then they would give you your own internal marketing organization. And so a lot of times we also found out that we weren't able to offer the full spectrum of plans because we were only representing one provider. And so now that we can do Aetna, Humana, Cigna, and the Alliance and Integrity Marketing have done a good job of offering a broad spectrum of providers and getting everybody trained on that. And through AHIP was kind of a new challenge that not only you went through for the first time, but we did also.
Okay, gotcha. So we weren't the only ones that were like, looking at things sideways when stuff would say we weren't ready to sell, even though we thought we were.
Correct.
Okay.
So it'll just get, if you went through the process, this was the Alliance's first time too, so the processes will get better. My thing that I would tell you, if you did not make AEP, do not fret. Don't say, well, I missed the ship. There's no way that I can do any good in OEP. That's just not the case. I would encourage you heavily to jump in both feet and do OEP. Some people actually have a better OEP than they do an AEP. There's less talk on the radio and the TVs. There's less marketing that happens. There's fewer calls. There's a lot of agents that just get in for the 2.5 months a year, and then they bow out. They're not really a full-time agent. And I think everybody on this call does this full-time, life and health. That's kind of our gig, right? So that is an opportunity that you will have. And I think after this call, you'll be able to see that there's going to be selling opportunities throughout the year, not just OEP. Does that make sense?
Yeah, it does. I think that's
Okay.
That's important. That's why I hadn't thought about the less competition, less marketing, less noise. Some people taking time off, just thinking it was a 2.5 month deal. I think those are valid points.
Oh,
So
they
that's
got their
good to
big,
know.
they got their big paychecks, and some of them,
golfing.
they're going golfing. So the cool thing about that is if you work this hard, if you get them switched, remember how on AEP where they could switch plans all up until the last day. They could have literally chosen 5 different plans during AEP, and the last plan in was the one that stick. On OEP, it's a whole different game. You get one opportunity to switch plans, and when you make that change, that's it. That you get one opportunity in that 3-month, January 1st through March 31st, that's it. So if you go in and you find somebody that's not happy with the plan, here is the advantage. These people, Joe Namath has promised the sun and the moon and the stars, and they're going to find out that, oh, my prescriptions are not covered. Oh, by the way, I'm not seeing the doctor that I'm not getting to see. It's going to create an opportunity for you. OEP was created specifically for people that chose a plan and they're not happy with. The federal government did away with it for a few years, and then because of the demand and the outcry, they brought it back. So y'all may not know the history on that, but just know that it's a blessing for these people to be able to come back. And if they made a choice that wasn't wise, or they were not told the truth, or they got scammed, this is your opportunity as a quality agent to go in and help them. It's really for Medicare Advantage people. This is not the time to switch your drug plan The only way that you can do that is if you go back to just traditional Medicare and you do your Part A and Part B, and then you can change your drug plan.
And you guys may have some people that were on original Medicare and a supplement, and maybe a Medicare Advantage is something that they wanted to try on. And during this period of time of OEP, if they wanted to drop the Medicare Advantage and go back to original Medicare during this time, they can. And then you can obviously sell them a supplement again and a drug plan at that point.
So I'll give you a perfect example, and sometimes it's not even out of a scam. So had one of my new agents call, and she said, "Hey, my customer went to use their doctor, and we looked it up, and they were in network." So I called the clinic, and I said, "Hey, we've got a customer here that's trying to use the clinic," and she said, "Well, we're not going to be taking any private insurance from now on. Not Medicare, not Medicaid. They're kind of a boutique clinic." And so what showed up, what was true last year, isn't true this year. So they're not taking any insurance. And so that's a time that we have to kind of go in and say, "Hey, now that your doctor's not taking any insurance, what's the best plan for you?" So it may not be of any fault of your own.
Okay, that's good to know. So some weird changes. So it sounds like this is certainly a season to pay attention to clients that you helped out, is the first thing I'm hearing. Is there may be some calls or some service that will help pay you dividends now and into the future as you take care of that. Don't be scared because your client's calling you. Don't hide under your desk and hope it goes away, but pick up the phone and engage. So there's flexibility to help improve situations, I think is the biggest piece I'm hearing.
Yes.
So OEP has from a compliance standpoint, it has a few more landmines. And what I'd like to do is I'd kind of like to just share with you a few of the do's and don'ts, and then we'll get that knocked out. And I really want to kind of close, or when we circle back around, I want to talk about the ways that you can make money during OEP, and because there's definitely some ways that you can do it. The thing that you don't want to do is broadcast market, notifying everyone that they can change. If you're not happy with the plan that you made, I mean, you can almost hear it in your ear, then the OEP is the time to do it. That's not compliant. You have to go in and say, "Hey, this is," like if you're calling your customers and you want to say, "Hey, I have been asked by some of my customers to expand the products that I offer. In this past year, I started offering Medicare Advantage plans and supplements. And so this is what I'm doing. I want to let you know that I'm in the Medicare business. I'm an educator. And if you have any questions, please reach out to me." Letting them know what you do, that is completely compliant.
However, don't just stick and say Medicare Advantage and supplements. You have to broaden that spectrum.
Right.
You need to say Medicare, dental plans, hospital indemnity plans. Throw it all in one sentence bucket so that they can pick and talk to you and ask you from that. Okay.
Right. So you want to let them, in this first month, what you're going to see is they're going to go out and they're going to get their first prescriptions, and they're going to try their doctors for the first time. Let them do that, and then find out what they do and what they don't like about their plan if they reach out to you. Okay. Don't let your clients get scammed. This is the opportunity to educate your clients. It can cost your customers $3,000 to $5,000. It's happened to me where they call and they will literally say this: "I'm calling you about your Medicare. I'm a licensed Medicare advisor. I work for Medicare." And you go, "Well, I already have an agent." "Well, who's your agent?" "Well, my agent's Cherish Obar." "Oh, yeah, I knew that." "Well, I'm actually calling for Cherish." And they will pose as Cherish. "Oh, this is Cherish. And our James told me to call you." So you have to educate them and let them know that they're going to get calls of empty promises. "Hey, you're going to get $140 back," because they see Joe Namath talking about $140. that plan is not available everywhere. So you have to know your plans well enough to know that, hey, the give back is certainly not available in most of the country, Florida and some of Texas and a few other places, but that's not the norm, but they're advertising it as the norm. Any questions up to that point? Okay. Don't change your drug plan during OEP. No OEP for Part D.
Yeah.
That's just a rhyme. No EP for Part D. Only if you're returning to original Medicare. Just talk Medicare education when you're trying to educate your customers. Don't contact people without their permission. So as an example, a lot of people are going to be happy with their plan, and they're going to call you and say, hey, my neighbor, they're going to want to help you because you ask them for referrals. Hey, my neighbor wants to get on my plan. Here's her phone number. Do not fall into that trap, please. You have to have permission to call. You can say, hey, I can give you my phone number. Can you share it with your next door neighbor and have her call me? But if you outbound call a person that's a neighbor, that is not compliant. Is everybody crystal clear on that?
Yep.
Okay. One thing, if you did do AEP and you made some money, I would say take about 25% of that money and reinvest it in yourself. The Medicare business is fantastic because it has residuals. So life insurance, we have nice big paydays, but if you stay with this, everything that you sold this year, you're going to get paychecks, and you're going to go, well, I made $250, $350, $400 off of that. And you go, well, that's a nice sale. But you're going to get half of that amount year over year over year over year. It's called residual income, and it depends on the your percentage that you're in, just like it does on life insurance. But if you want to start building residual income that can be significant, I have agents that are at 6 figures on residual income, and that means they make that before they even walk out the door. And so then you start adding life insurance. The thing that kills new insurance agents and all insurance agents is they don't have enough money to sustain themselves. They try this new career, and they're only as good as the last month that they had selling life insurance. And adding this dimension will help you make sure you get to stay in this wonderful career. Okay. Any questions up till now?
Good so far.
Finding is very, very important. Doing it right now is very important if you want to get in the game with OEP. Okay. January through March. If we're going to buy leads, it typically takes 2 to 3 weeks, especially if you're doing mail leads, for them to get mailed, come back, etc. And then you dial them. But we are not mailing. You're going to call a lead company and say, hey, I want OEP leads. That does not exist. So what you need to ask for are SEP leads. And what does that mean? Special election period. So you're looking for people who are turning 65. Isn't everybody? You're looking for people who may be dually eligible. Maybe people who have chronic conditions like diabetes or diabetes or heart issues. So those types of leads are what you can buy, purchase, and go ahead and invest in so that you can sell them. Because not only do you have OEP for people who are in a plan and want to change, those other people that I mentioned, the people who are aging into Medicare, the people who have diabetes, the people who have Medicare and Medicaid, they also have a special election period during OEP. And you could actually use one or the other.
Yeah, so the Alliance, does a really good job with these mailers, and buying leads from the Alliance, I highly recommend. We invest. Matter of fact, our accountant is like, "What is this large expense here?" And it was, well, we're buying leads. Well, for real, I guess we'll categorize that as advertising. But if you're not investing in these leads, the great thing about them, the Alliance leads, is they have a long shelf life. Even with life insurance, some of our three-year-old leads have been gold nuggets. And so that's the beautiful thing about the direct mail pieces. Telemarketing leads, there's a company called Lead Heroes. Might want to look at them. Also doing Facebook ads are Bang Bang leads. I don't know if you're familiar with that, but those are instant. And somebody literally clicks on, hey, I want information about Medicare. They click the button, and that when that happens, immediately you're sent a notification, and that becomes a hot lead. You don't have to wait for that piece of mail to go back to the alliance, and then that lead to generate from the alliance back to you, which can take weeks. So that's great. Also doing educational Medicare seminars. So that is something that I highly recommend, whether it's for a church or you decide to do it at a restaurant. You can send out invitations. You can do it on Facebook. Hey, if you'd like more information about Medicare education, we're going to be doing something at the Cracker Barrel. We're going to be doing something at a local church. That's fishing with a casting net instead of a cane pole. And so it's something that works. Go ahead.
Yeah, so I was just going to say, you don't have to be the expert on Medicare to do a Medicare educational seminar. Okay. I used to work for a carrier. I worked with many agents that had no idea what they were doing, but they could pull up a slideshow and read. Okay. And make sales. So don't feel like you need to know it all. If you get questions at a seminar, take a name and number, and then get somebody to answer those questions, and then call back, and you are the expert. That's the beauty of this model.
If you're taking notes, this is going to be the most important thing I've said so far. These are free opportunities, FREE, public events, anything like fall festivals, spring festivals, winter festivals. You need to get out there. Retail locations. I've got one of my agents at every single dollar store in East Texas. He's got it covered with either him or one of his agents. Being at Kroger's, I think we probably wrote 75 policies just standing outside of a Kroger's grocery store. Doctor's offices, creating conduits. Find a pain management doctor, find a dentist, anybody that is taking Medicare patients, then you need to go to them and say, listen, if you have someone that's on traditional Medicare and they're talking about, hey, I can't afford my copay, then please, I'm going to leave you a stack of these permission to contact. And if you'll just snap a picture of it when they complete it, send it to me, and then that is permission to contact, legal permission to contact, and then I'll come by and pick up the hard copy just so I have it. But that way you can reach them. I bet we've closed 25 just out of one pain management doctor. Mm-hmm. So food banks are a fantastic opportunity as well. You've got opportunities for people year round that may qualify for low-income subsidies. And so you want to talk about that since that was your.
Yeah. So if you have a client that you think is lower income, okay, maybe they don't have Medicaid yet, maybe they don't have Medicare yet, you can help walk them through the process. What you find with this particular demographic, which is a lot of times our final expense leads, right? Like there's not a high educational level in the household. There's not very many supports in the family. So you being an agent that wants to do the right thing, you can go in there and actually help them fill out an extra help application.
Takes 10 minutes.
Mm-hmm. It's on ssa.gov/extra help. If so, if they had expensive medications, that removes a donut hole from them for life, as long as they have extra help.
And their Part B premiums.
Also, the other thing that can happen.
Wait. Can you say that website again?
SSA, like Social Security Administration.gov. And it used to be /extra help. But if you type in that into your search bar and it doesn't pull up because they change every year,
Scroll all the way to the bottom. And you're going to see 2 lines that says apply for extra help.
and you can do that with your client. Absolutely.
Do not call it low income subsidy, even though that's what it is.
We never want to offend anybody. We want to be sensitive to their financial
Just say,
situation.
Hey, if I could get you some extra help, would you just let me spend 10 minutes? The best call you're ever going to get back is like I had last night, where a lady said that I'm full Medicaid now. You initiated the Medicaid enrollment by getting them enrolled in that low income subsidy, getting them that extra help. It fired off their Medicaid application. And so I was able to move her from a traditional Medicare plan to a plan that gave her $3,500 worth of dental, $100 of food card. I completely changed the lady's life. All of her healthcare is going to be zero now. And so that's a real ministry, and that's you're making a significant change. And if you do that kind of thing as a good agent, those people will never leave you. Like
They will call you every time they get something in the mail.
oh, and your leads, like you get somebody on one of these plans and you help them get on Medicaid, they will tell every friend that they have, hey, you got to use my guy.
That's true.
Assisted living. This is a huge part too. There's an agent there in Dallas that got with one assisted living, and it was connected to 10 other assisted livings. And now all he does is he calls on those assisted livings. He put himself in to where anytime a new person comes into that center and as a resident, they're part of the onboarding. Every quarter, he's doing a Medicare education seminars at those assisted livings. He does nothing other than just service that. He doesn't make outbound calls. He just takes care of that group of people, and he's a millionaire doing it.
Just got to be consistent in whatever you do. Like relationships aren't built in a day, and funnels for referrals aren't built in a week. You have to be consistent, be in their face, and keep going.
Perfect. Question. Let me see if anybody can answer this. At what time can I change into a supplement, Medicare supplement? Does anybody know? The answer is you can change into a Medigap. What? Did I have an answer?
Anytime.
There you go.
There you go. Kevin's sharp, man. I appreciate it. Yeah. Medicare plans and Medicare Part D prescription drug plans can only be changed during certain times, but a Medicare supplements are different. You can change them at any time. So somebody's going to get that for whatever reason. That question's been coming up a lot lately. And so I just wanted, since it's coming up, you also have a free 30-day look. So you can always tell them, hey, get in this thing. If they decide that they don't want it, they can go back to whatever they were in originally. Okay.
Excuse me, this is Lindsay Barron. I have a question about supplements.
Yeah.
Quick question for you. I have a client that just got off her husband's medical insurance and went to an MAPD starting January 1st. She still qualifies for a supplement, and she probably needs to go that route because of her health, but she signed up with United Healthcare. Can she keep a United Healthcare drug plan and go to another carrier supplements, or what's the situation with that?
Yep, absolutely. I have a lot of clients that the drug plan's better with X carrier and the supplement is more cost effective on another carrier. Yep,
Okay, so we can totally take her out of the MAPD and put her on a supplement and a standalone drug plan, no problem.
during OEP. Yep, but she
Okay.
will probably have to qualify medically, but yes.
Okay.
Yeah, and so that's a great question. You know, the formularies change from company to company. So one may carry a certain diabetic drug and the other one doesn't. And so it's important to be able to use the Alliance has, you know, now that we've partnered with Integrity Marketing, has a great Medicare tool, and you can look up their drugs, or you can go directly to the carrier site, put all their drugs in, make sure that they're covered. Okay.
Thank you
Does
very
that
much.
help?
Thank you.
Yeah,
Yes, it does.
absolutely. If you're not using that Alliance intake form, you can go on the Alliance website and print that out. We use that on every single person that we do an application on. And especially for a new agent, it makes it to where you can hardly make an accident. You fill that information. It's like getting the green sheet on the life insurance or annuities. It'll just make you a way better agent if you do that.
Hey, what did you say this sheet was, and where can we find it?
The Medicare intake sheet, if you go under ARC, under carriers, under Medicare Advantage, at the very top page, it's called a Medicare intake sheet. And I love it. It's name, Medicare number, Medicaid number, prescriptions, doctors, all listed out. And then you just kind of fill it in. And the great thing about that, having a page to fill out, you can also put in the enrollment confirmation code that you get if you're doing it through Medicare Center. And then if you do the health assessment, if you're an agent that does that, you can put the health assessment ID and kind of track those things as you go along. Highly recommend that.
Let me ask you this. Does anybody want to get paid on the applications that they wrote? Yes. Yes.
Seems simple.
And because this is a whole new process, you need to have a system of checks and balances. So especially in this first couple of years that the Alliance and Integrity Marketing are doing this, you need to make sure that you're getting paid on everything. And the only way that you can do that is if you go back through
And check it.
And so it's not just me thinking it's a great idea to make you a better agent, but it also help you get paid. And so
True story. I had a carrier. I logged in on the carrier website. I was doing an application. It took forever for my client to find her Medicare card and her Medicaid numbers and all of this stuff. So by the time I was filling out the application, I filled everything out, but it had timed me out. Okay. Which means that the application went in, she got approved, but they were never assigning it to me. Okay. It can happen. So those types of things, if I didn't have my validation, if I didn't have my scope of appointment, if I didn't have that, they would have never given me credit for the sale. So we say that from experience to make you a better agent.
yeah, these are pro tips that you won't have to learn the hard way like we unfortunately did. This is another thing I want you guys to write down. Another pro tip. If you do not know your carrier representatives, United Healthcare, Humana, Aetna, Cigna, whoever is your carrier that's doing well in the zip code that you're at, or those zip codes that you're working, you need to reach out, call Ivy, say, hey, who's my agency manager for this particular carrier in this area? And you need to reach out to them. Tell them, listen, I am classically trained in making outbound calls. That's what I do. I make 100 calls in a sitting. They do not have that with the other agents that they have. Medicare agents typically are not huge outbound sales type people. They don't. And so they can't find people to do what we're already trained to do excellently. And so in every situation where I put one of my agents, the carriers have come like, oh my gosh, I can't believe how great your agents are at making calls. So you're going to get opportunities like, hey, I have a lost lead list. Can you do a call-a-thon this weekend? Well, yeah, I can. We've got 200 leads right now that we're trying to get through, and they're time bound. So we've got about 48 hours to work them. And we're closing about half of them. So put yourself in a position to win like that and reach out to the agency managers in your area.
Make sure when somebody calls your phone and you don't get to your phone, that your voicemail is professional and they know who they're calling. Okay.
Right.
Because so many people, I will tell you, since I have changed my voicemail to say who I am, what I do, and how I can help, I've gotten more messages left than I actually anticipated, more than hangups. Okay. So change your voicemail if you don't already have it changed to let people know what you do.
Right. And so, we're talking about OEP, but also with the SEP, like we said, you're going to have the dual people, Medicare and Medicaid, the chronic people that have special conditions, but you also need to look for 5-star anywhere that's close to you. Even if you had to go 3 or 4 counties over, look in your state, ask Ivy, hey, where are the 5-star plans? With the 5-star plan, it's like playing with aces. And you go, oh, I can change that plan. Remember how I talked about you can't change during OEP? When you have a 5-star plan, you can write that sucker. You can say, hey, this is the state's only 5-star plan. I can move you because Medicare says this plan is so good. They gave it a 5-star rating. I can move you at any time.
One time per year.
There you go.
You can use it one time per year. And they're very rare for a health plan to get a 5-star rating in the Medicare Advantage space. But Ivy will have a list and you can ask her and she'd be happy to help. Okay.
Any questions on that?
Question of a different area. Who would you suggest we speak to at a assisted living? What position in that building would be able to assist me?
It's a great question. The activity director would be great. Or the administrator. The administrator might actually be able to turn you on to multiple locations, and you could do a little research to see if they're affiliated.
Sometimes they'll have social workers that work there. Tell them how you can help people. Some of them don't stay in assisted living forever. Some of them move back home. You know, you never know what changes. So if they move in and out of facilities, y'all know that there's a special election period for that too. If they're in a nursing home and they go home, they're in an institution. That's an SEP. If they're in prison and they go home, that's an institution SEP. So think about that as well.
If they moved, right? Yeah. So here's the other thing.
Don't go hang out in the prison yards, y'all.
Yeah,
Okay?
no. But if you have a situation where you go in and they go, well, we have a guy and he shows up during AEP and he comes and does one talk a year. You take his business. You take his business. You show up at OEP, you go once a month, you call bingo, you start doing, like, just because he or she was the first person there.
They get lazy.
They get lazy, they get complacent, and you go take their business. Do a better job.
Service. Medicare is a huge service business. Yes, what James and I are doing right now is a ton of calls. Hey, I got my new card. This is what James is great at. When his clients, before he hangs up the phone, when he writes the policy, his signature line is, hey, I want you to call me when you get your ID card in the mail because I will worry about it if you don't. Okay. That is his signature line. Use it. It works. Those clients don't want him worrying that he didn't get or she didn't get their card. But the moment that they're calling, that's, hey, they've got my number saved in their phone. I'm their agent. Oh, by the way, the doctor on here is wrong. Hey, let me solve that for you. Let's get on a 3-way call with the carrier and let's fix that right now. What are you doing? Service. They're going to stick with you. Hey, have you also ordered your Philips Lifeline, your emergency button? Have you ordered your over the counter? Hey, service.
But you're training your customer
To call you.
and to do the follow-up call. They're calling me to do the follow-up call.
Kevin, you got your hand raised.
Yes, ma'am. So my challenge has been just that, is that people are calling me for stuff that I don't necessarily think they should be calling me for, i.e., hey, this drug cost me $100 and it's only supposed to cost X amount. Do you all spend the time to track that down? Because I feel like I'm getting inundated with all of these calls and I don't want to be the problem solver. But I've turned into a problem solver.
So yes and no. They need, when you do the initial enrollment, you want to flip to the back of the enrollment book and say, here are your key, if you need your hearing exam, if you need your dental, if you need, there's a
All here in the back of an enrollment book.
all there. And this is, so if you have any questions, you can, that makes them pretty self-reliant. But let's just be honest, there is a group of people out there that need your help. And without you helping them, they'll either go to somebody else.
So James had a client who had a prescription and it was like costing him $700 at a Sam's pharmacy. So James actually took the client back to Sam's pharmacy and said, ma'am, this drug right here is only what, 48 bucks, 50 bucks?
48 bucks, yeah.
Okay, so I'm gonna need you to refund my client this money.
Yeah, she had to, if she could have killed me with her looks, she would have, but I made her
It was the right thing to
peel
do.
off 7 $100 bills.
So look up the drug. So what I would do if somebody called me, Kevin, if somebody said, hey, my drug seems to be costing me too much money. Okay, do me a favor, pull out your member ID card, because you might not remember what plan you wrote her on, right? Tell me in the upper right-hand corner or the lower left-hand corner, what is that plan code? You're going to get in Medicare Center and you're going to look it up. You're going to type in that medication while you're on the phone with her. It doesn't take long. And you're going to see, hey, this medicine is only supposed to be costing you blank. So maybe you're going to a pharmacy that doesn't accept the plan. Hey, if you go to this preferred pharmacy, let's change it from CVS to Walgreens, whatever that may be. This one will give you X price for it. That's a simple fix.
Correct. All right, I'd like to open it up for questions and,
Oh, yeah.
and
Let's do that.
All right, I know we've been getting some along the way. I've got a couple things. First is on compensation and tracking things. One of the things I thought was nice is I think we were prepped to expect for commissions to come in toward the end of January, and we've seen stuff getting deposited here in the last 5-10 days. So that's been faster than we thought. That's been good. Any tips on tracking compensation that y'all have seen so far? And I know you may be newer, you've been doing this first year through with us too, but what are the things you've picked up so far?
yeah, so you're going to see a bunch of compensation, and there's a bunch of things that each of the carriers dumps the money at a different time. You're going to get paid a certain amount for the initial, and then you're going to get paid another amount after that once you've had what they call a true up.
Yeah.
And so you really won't be able to figure out who's who in the zoo
Till the end of the month.
till about January 28th. And then you'll kind of figure it out what you got paid on. And then you'll be able to see if you have any that you didn't get paid on. The one thing I would tell you if you didn't do it for AEP, if you're not doing the health assessment, we had one agent that didn't do it, and they missed out on about $8,000 from my figuring. And that's just taking 3 minutes and asking them simple questions about their health, their medications, what they need help with. And
each carrier has a different assessment. Some carriers, I can attest, the health assessments are more difficult and cumbersome than the others. But you should at least go in and try.
right. It adds up. $50, that pays for your gas. And before we all got into the alliance, if you made $50 an hour, much less 3 minutes,
It's a good day.
that was $100,000 salary. That's what $50 an hour
And
is.
50 is just the minimum. There's some carriers paying 75 and some pay 100, depending on the type of application and who the carrier is.
Do you know how that health assessment is listed on the commission statements? Because I've done quite a few and haven't seen it yet, so I don't know if it's coming
It is
later.
It'll show
It's the
up.
last to get paid.
It is. So
Okay.
give it 2 to 3 months for it to really shake
Okay.
out and come
Okay.
through after the application is active. But there's a health assessment, and sometimes they'll attach it to a name. I don't want to get into the commission stuff because I'm not sure, but I think we've seen it come in as a HA and then a name. Under
Okay.
other.
Okay. All right. I was also told I did a drug plan for Anthem, and they said they did not require that, but the other companies did. Does that make sense to you guys?
So health assessments for drug plans is not, you won't get paid on those.
Okay.
It's only MAPDs.
With any. Okay.
So the other thing is, since you're in these homes, make sure that you're asking all the questions. I think Megan Wood's probably the most amazing at doing that. She will know what insurance every single person in that household has. And, I would just add, you can do the same thing with this. If you see that they have a teenage daughter and and they've got braces and they don't have a dental plan that they own themselves, like a Cigna dental plan, which are fantastic.
Yeah.
They need to be on that. If you know that they're going to be making trips for surgery, put them on these indemnity plans. Don't miss opportunities that are just laying there for you during OEP.
Okay. That's big. So you've hit on some SEPs. I kind of want to recap on the ones that I know about, and I might have some other questions on leads. So we know about the 5-star SEP. Moving, as in changing zip codes, but then moving in and out of an institution is separate than just moving. There's 2 types of moving: in and out of an institution, as well as changing your zip code.
Right. They were in a nursing home, and they were in a nursing home. Didn't have to be a prison. They were in a nursing home, and they made it out of rehab. They had a fall. They got COVID, and then now they're coming back home.
That's an institution.
They were on
SEP.
straight Medicare while they were in there because that's what the facilities want. And then they're going to come back. You're going to be able to put them on a plan.
All right. So 5-star plans, moving, in some of change zip codes, in and out of an institution, be it nursing home or assisted living or prison. DSNP, right? This is a dual special needs eligible. Is it the military? Like if they're a veteran and they qualify, is that a constant? Is that a year round, or is that on the
So if they
plans?
If they retire and they drop anybody that retires and they drop their credible coverage, then that's an SEP.
But if you have somebody who's a veteran, maybe he's had VA coverage, drug plan, whatever, there's a special election period. It's SEP OCC for other credible coverage. So if they are looking at an MA only plan, you can use that SEP to get them on that type of plan.
Yeah, I want y'all to pay attention to what I'm about to say now. There's also an SEP for natural disaster, and we killed it last year with that. Florida has tornadoes. They had one building in Dade County, Miami, fall down. The entire county of Dade, which almost goes down to the Keys, was included. They gave them a special election period. In Texas, if it froze and we were without power 2 days, we got a special election period.
For like 4 months.
Yeah. If you got a tornado that runs through your county, guess what? You're going to get an SEP.
Maybe.
Yeah. So watch out for them. Ivy will have access to them.
And United Healthcare as a carrier is really good about posting it on Jarvis, which is the carrier's homepage. All of you that are contracted with United Healthcare, I hope you log into Jarvis and look around, because they'll put things up there. Hey, there may be a SEP available for Mississippi. There is one right now. But it will let you know in areas that you're licensed, those types of things.
There was SCPs for COVID. So take advantage of that.
Yep.
Okay. Yeah. So I've heard COVID has been used as an SEP, and I've heard that it's whatever that was. I've heard that is still available or being used. I've heard some people say it's tightened up. Is there any declarative statements on that?
You just have to look. All this is done by county, right? City, states, and counties. And so you just have to look by county. That's my best. Just like these plans, one county will have a fantastic plan and the next county over has nothing.
Okay.
Same thing for certain states. So,
all right. The Medicare direct mail leads that we get through the Alliance, I know those, we call them the Medicare savings leads. Are those tailored to like different types of data? Like, so I know they're being created, or they can be created, but I wasn't sure if those are good year round as they're being created, or if you have any other insight on how they are and what to look for there.
So we use the Medicare savings leads and we kind of get to customize and tailor them. I think they have a lead company that kind of helps you create that. So we have a certain income parameter and then a certain age parameter that we're looking for those Medicare savings. And so I think there's a little bit of customization that you can do. before you send them out. But keep in mind, if you're looking at people who are qualified for that Medicare savings, that low income subsidy or extra help program, you're going to have that once a quarter per year SEP for the duals.
And if you go outside the alliance, you can absolutely, there's dozens of companies out there that will do mailers for you.
Absolutely.
And they can hone down to age, income, whether they have Medicare, Medicaid, where they live. Like you can get so narrow on it that you can narrow it down to, hey, I want the supplement market, or I need the low income market, or I need those just turning 65. You can get very specific with it.
Okay, got it. Good to know. Okay, and then I know Bang Bang, I know John Davis, I've known him for several years before he launched his lead company, but I know that they can do Medicare. I don't know if I haven't asked if he targets turning 65 or have you guys worked with Bang Bang or any of your agents for Medicare?
Yeah, we were actually the first one to say, hey, can you do Medicare? And he's like, let me check on that. I used to, and then he called us back and said, yeah, I can do it. So he has the ability to, and again, he can kind of tailor on Facebook. You can tailor that, or you can work directly with Facebook and say, hey, I want to go after these people in this age group, and they can do that for you as well. I wouldn't recommend that for a new agent because you could step in a compliance hole.
Yeah.
And if you do try that, I'd run it by Gina or Ivy and say, hey, I'm thinking about doing this. What?
Always do that.
Look at my verbiage on this thing. Yeah, that's a good rule before you spend the money on marketing something. Like we developed a mobile enrollment bus, and even as experienced as we are, we ran all that stuff by the carriers, and the verbiage that's on our enrollment bus passed both Ivy and Gina.
Like everybody knew. Yep.
Okay. All right, well, that's good. Leads. I'm trying to think if I got other questions. Made me think of a couple other things in the back of my head, trying to recall now.
Anybody else have questions?
Yeah, I've got a question. What advice would you have? I'm licensed in 4 other states besides my resident state, and I'm not doing much life in those states. So I want to see if I can reach out and do some Medicare. How would you suggest that I set up an in-house telemarketing program, but trying to be compliant with everything? What are the holes I have to watch out for so I don't end up with a sheriff here at my door?
So what do you mean in-house telemarketing?
Well, they might office, calling out of
Okay.
just as I set
Okay.
up appointments here to go out and see people.
Yeah, so I would just buy leads in whatever county and whatever state you want to work at, and then just start running them. Most of my Medicare business was
Yeah.
over the phone.
Yep.
Really? Okay.
Yeah.
James did a lot of face-to-faces, but he's amazing in the home. Me, I'm comfortable with my verbiage. I'm comfortable with my sales tax. It's over the phone. And that's what I did most of it.
And if it's so easy now to do, you can either do it by text, you can do it by email. United Healthcare has an application you just do by voice,
Humana does voice.
20 minutes, and
Aetna has voice.
you do the health assessment and everything right then and there. It's
So
super-
when you say voice, you mean that you do a joint call and
it's a
somehow-
recorded line. Yeah, it's a recorded line. So you go to your customer, hey, what we're going to do is I'm going to get on a recorded line here, and I'm going to be asking you some canned questions. I need for you to answer just yes or no to these questions. It's going to take about 20 minutes. And at the end, they're going to give me a confirmation number. I need for you to be real quiet during that period of time because I got to write that number down. So I need to make sure that you get enrolled today.
Sounds like somebody's been doing that a lot.
And so you go through that, just that system. Hey, do you understand the question of the plan as I described it to you moments ago? Yes or no? Yes, I understood the plan that you talked to me about. And so it's very, very easy to do. And then you write the confirmation number down and it's done. If they are not good with email or text, This is for the non-savvy technical person or
Right.
the person that's got sight or hearing problems. You can take them through that in about 20 minutes.
Okay, and on average, if you could, how long do these calls take?
So
An hour to an hour and a half.
And you
for a
find most
new
people
agent.
are comfortable sitting there like that? They don't have to take a bathroom break?
I don't even ask.
so sometimes what I'll do is I'll talk to them about the plan,
Okay,
and we'll do a scope, and then the actual doing the enrollment about 22 minutes.
Yeah.
Okay.
You know, you got to go through the drug list. You got to go through the doctor list, and depending,
Sure.
I had a lady call me and I said, "How many specialists do you have?" She said, "A bazillion." I said, "I'm writing you a supplement. You don't need the extra benefits. We'll give you a dental plan." But you know, you got to know those things, and you kind of learn as you go.
Okay. We are going to be gearing up to launch our new office space beginning of February, and I know Megan's got an office space. I know Jake and Ray have an office space. A few others open it up, and I know the carriers will advertise us as an Medicare Enrollment Center. We've got to have specific days and times we cover for that month if we agree to that. Tell me what any tips on whether, you know, what to have if we've got a room that's going to be dedicated to that. Anything, just whether any tips in general on the space itself, or better days or worse days, or anything else from experience there.
So Mike, what they'll do is they'll pay, like I'm looking out our window right now. We've got 2 4x8 windows, and they made sure that our windows are covered with United Healthcare Enrollment Center. Ask us about Medicare. They're on both of those windows. We've got a billboard right outside that says Enrollment Center.
So basically inside our office, what we have is a sitting area with 4 or 5 chairs. And then I've got a TV set up, and I have a loop of Medicare 101 that plays. And if somebody were to come in, or when I get a bunch of people coming in, we can stop it, and then we can just go through and have a conversation about the slide deck.
But as long as somebody's there at that office, even if it's Tuesday, Thursday from 10 a.m. to 2 p.m., they will send out mailers within like a 5-mile circumference that are free, that you do not have to pay for. And as long as they know that you'll do good on those leads, then they'll send them out, and then make your area a designated enrollment center. That's just smart. And
sometimes if you have a good book of business, they will send it to your book, and you know, pick a carrier, whoever's big in your area, and they will send out postcards or flyers advertising you as a Medicare Enrollment Center to your book of business, and they pay postage or whatever.
or you can do events outside. Like we pulled the mobile enrollment center right outside our office, and we did hot dogs and hamburgers, and like, you just make it fun, you know.
Okay.
It's just an activity day. Or you can just make it educational. Just pull it out there and give them education.
Got it. Okay. All right, good. I appreciate y'all taking time. Any other questions? Jennifer, Charlie, Kevin, Brian, Paige, Tyler? Okay. Well,
Right. I'm going to give you, if you want me to give them our phone numbers in case they have questions?
absolutely. I appreciate that. Yes.
Okay. Because there's going to be something that comes up, and
I'm gonna put it in the chat.
we're going to put this in the chat and let you know. I'm going to tell you, you can call us at any time, and people don't believe us, but they do. And they're like, I just can't believe you gave your phone number out, your personal cell phone number. But we will answer the phone call if we're not doing an enrollment, or if we're not in training. We are in 24/7. So we answer the stupid call at 11:30 at night going, I have a question. Like, sure, go.
I'm good.
So there's a personal affirmation when it comes to work in the Medicare business. Work hard. Work only half a day. It makes no difference which half. You can work the first 12 or the last 12.
12 hours.
Just work hard.
Right. There you go. Charlie, did you have your hand raised with another question?
You're on mute, buddy.
His hand was up there for a second.
Yeah, I can't see the chat. I'm on my phone. I can't find the chat.
I'll text you their numbers. I've got it. I'll
Okay.
send it over to you, Charlie.
Okay.
Okay, so we're gonna be at the NatCon. So if you see us, you know what we look like now, grab us, and if we can help you in any way, we'd love to meet you in person.
Yes.
And anything that we can do to help, we will always be here for you guys.
Yeah, there you go. Absolutely. I think everybody here is going to be there. Going to be a great resource, catch up with more carriers and the OBARs and Ivy. So thank you guys for your time. Just very, very grateful. Appreciate the fact that you've taken the choice to run from where you were to saying, hey, we want to give our agents an opportunity to grow. We want to give our clients opportunities for more carriers. And I'm just expect you guys are going to continue to blow this thing up. And we're just looking to ride on your coattails with your knowledge and kind of riding your wake here and have some fun.
It's not like this everywhere. Yeah, this is a very unique opportunity.
What advice would you have? I know that Mike has been instrumental in helping us get licensed agents, but more specifically, what advice would you have in looking specifically for people who have a Medicare background?
Well, look at this. So we recruited 2 New York life agents this year.
Okay.
They're not going to write life for us because they're contracted, but they called every single one of their customers just to let them know that they're adding this dimension. And
Okay.
so brand new to Medicare, one of my New York,
What would that do to your business if you just targeted maybe a PNC business or
Okay.
another life insurance?
a farmer's agent.
It's captive. Think about that.
They're not adding this element, and this is kind of a Me Too thing. Realtors are fantastic because their off time is October, November, December, and then they don't get busy till
Spring, summer.
spring and summer. And so we've got several that are realtors in our organization, and it works perfectly.
Start there.
Okay. Thank you.
Yeah.
Very good.
Awesome. Guys, thank you again. Some good questions. Thank you, Charlie. Guys, take care.
All right.
If you have recorded this, we'll try to have it available for anybody that needs to review it. Thanks.
All right. Bye, guys.
Bye-bye.
Bye.